Hello, it's Robyn Murray. I am a pelvic health physiotherapist, orthopedic physio, mom of two, and women's health consultant. This video is for anyone looking to learn how to access their deep core. If you hear in my videos or other videos, activate your deep core, this video will give you the tools in order to do that. As with any of my videos, if anything causes pain or does not feel right, I highly recommend reaching out to a qualified health professional or pelvic health physiotherapist prior to embarking this on your own. Also, I am starting to launch more in-depth videos, both for clinicians and people just looking to learn more about their body. If you would like access to my Deep Core 2.0, which goes over common presentations, how I might be finicky with how I prescribe deep core activation, shoot me an email or see the link below and how you can purchase those for a very small fee. Make sure to like and subscribe in this video. So, accessing our deep core. There is a lot of different ways to access our deep core. In my practice, I really utilize the power of the diaphragms in order to sync up fluidity of the deep core system. Why do I do this? So it becomes automatic. This is an autonomic process that should happen without conscious awareness. So if we can neurotag it, which means from a motor control standpoint, utilizing something that happens all day long, which is our breath, then this can become more automatic rather than you having to think about your deep core systems. Depending on the presentation, if done well, you shouldn't have to think about this as much, but it really depends on the presentation. So the first thing I'm going to talk about is the respiratory diaphragm. We're actually made up of 4 diaphragms. These 2 diaphragms I talk about in my more in-depth videos, but for today's video, we're just going to focus on the respiratory diaphragm and the pelvic diaphragm, which most people think of the pelvic floor. Going back to biology, basic biology, when we take a breath in, our diaphragm moves down into our abdominal cavity. We know from the literature that the pelvic floor also should open and eccentrically lengthen or move down towards our feet with that breath in. So the first step for most of my clients is really starting to work with the breath. So while you're here with me, I just want you to take a breath in and notice where it is in your body. And you might not know. And the first step for you might just be paying attention to your breath. Place your hands on your rib cage. And if you're not sure where your rib cage is, you want to feel along the sides of your body until you start to feel it be squishy. Okay? When it's squishy, that's your abdominal cavity. Try to find right between where the bones end and where the abdomen begins. And then take another breath in. Where is the breath? Is it in your belly? Is it in the back? The diaphragm is a 360 sheet of muscles that attaches to the front of the rib cage, to the back of the rib cage, and goes down into the pelvis. And it has fascial links, which are spiderweb material, down to the pelvic floor. We know when we have babies in the 3rd trimester, with the most recent literature, in between those diaphragms get disrupted. I'll often use something like a band in my practice. So if you have something like this kicking around, grab it now and place it around the bottom of your rib cage. Okay? And just apply a little bit of pressure. As you breathe in, that band should expand 360, okay, at the back, the sides, and the front. Sometimes seated can be too much for the postural system, so you can also try this lying down, okay? So breathing in and out. Great. And you can place a hand on the belly to see what happens when you breathe out. Breathe in and breathe out. What happens with the belly there? Does it draw in? Does it push out? Getting an idea of what happens. And we'll talk about what when we activate our deep core on exhale, what we should be looking for in the next step here. But before we do that, let's move the band a little lower. So it is around your hips or your abdomen. I really like putting the band around my pelvis, around your pelvic bones, which are your hip bones, because the pelvic diaphragm lives down here, okay? And when I breathe in, I think about expanding that band, especially through the glutes, just like the bottom of the rib cage, and then exhale. And you want to think about expanding 360 in this pelvis. So giving that a go again, breath in and out. So the first step is just the breath. And my running joke in practice is I tell people to drink water and breathe all day, and I kind of do. So how often should you attend to that breath? As often as possible. A really good way to do that 360 breath is when you're going to the washroom, because when we urinate and defecate, our pelvic floor should open and relax. When you're at a red light, when you're washing your hands, and of course during exercise. If you're following any of my videos and you hear me say breath in, thinking about that specific breath prior to your exhale, where you access the deep core system. So let's move to accessing the deep core system. Now this takes practice, okay? And if you're unsure of whether or not you're doing this correctly, that might be a good indication to reach out to someone for guidance, okay? So I'm just using a washcloth here to kind of show you where the pelvic floor lives, okay? So if it lives like a hammock at the bottom of our pelvis like this. It's a sheet, okay? You can imagine it as a trampoline, all right? So as we exhale, as I said, we should have that pelvic floor and the deep core system, which lives above that. The belly button would be right here, okay? Come up and together. For this video, I'm just going to be cueing the pelvic floor, okay? And for other deep core systems, that would be individual based on the person. So I'm going to keep that to my more advanced videos, okay? So taking that breath in, on exhale, the posterior pelvic floor, which lives around here, so the rectum is here and the two sit bones are there, I want you to think about tipping your sacrum or your tailbone in towards your midline and drawing a marble up your rectum. Another cue I use is if you're going to pass gas and you don't want to, what would you do with your muscles in order to make sure that doesn't happen? I want you to put your hands on your glutes, okay, which are the big muscles at the back of your pelvis or your bum cheeks, to make sure those aren't the ones firing, okay? Take that 360 breath in. Then exhale, thinking about tipping that sacrum in and drawing that rectum up. That is your posterior pelvic floor. Notice if your glutes are gripping, okay? Breath in, let it go. And exhale, drawing that posterior pelvic floor up. So that's the posterior pelvic floor. The middle fibers of the pelvic floor live right here. So if vulva is here, they're right either side of the vulva. So what I get my clients to visualize is their vulva, but just a little bit deeper inside the pelvic cavity, okay? For some of my clients that are more comfortable with their bodies, you can, with clean hands, gloved hands, insert your fingers into the vulva and vaginal cavity either side to see if you can squeeze and lift those muscles on exhale. So let's just do the Middle pelvic floor, where you breathe in 360. And then exhale, think about squeezing and lifting just above the labia towards your head. Great. And trying again, breath in. And exhale, squeezing and lifting the middle fibers. Wonderful. Now we'll do the last part of the pelvic floor, which is the anterior pelvic floor. So this is what lives around your urethra. If you're having leakage or pain in that area, this can be really helpful. And if you're experiencing more pain, you want to be gentle. You don't want to lift aggressively. And there is more nuance, but of course, if anything doesn't feel okay, that's when you reach out for help. So breath in again. And then what you want to do on exhale is thinking about pulling your clitoris, which lives right here, or your urethra, in and up. Sometimes thinking about lifting your uterus a little bit, really low down, can help those anterior fibers. Those front fibers are very small. So again, breathing in. And then thinking about pulling that clitoris or drinking a smoothie with your urethra in and up. Those are the anterior fibers. Now we're going to do the back, the middle, and the front all together. And that is a full pelvic floor activation. Breath in. Exhale, sacrum tips in, rectum lifts, thinking about bringing those vulva in and up, and thinking about bringing that clitoris in and up, and hold for 5, 4, 3, 2, 1. Now notice as you inhale that drop in that relaxation. If you're new to this, you might not be able to feel this. And if there's a really big disconnect there, you might want to try some of my mapping videos first. As of recording this, they are not up yet, but if you subscribe and follow, I will be putting mapping videos, which might be the first step for you. If you're like, Robyn, like this breath in this pelvic floor is just not happening, that's when mapping might be a really good step for you. So we'll do it one more time before I close this video off. We're going to breathe in 360. And then exhale, thinking about bringing the rectum and the tailbone up, the labia in and up, and the clitoris in and up, and hold for 5, 4, 3, 2, 1, and exhale. So we want to think about supporting the organs from the bottom. So all of your organs live in your pelvis here, like your small intestine, your bladder, your large intestine. You just want to support, okay? It's not like you're giving a max activation. Think about the task at hand. So say you're doing a Pilates movement where your legs are up and you're straightening a leg. Can you stay connected to those muscles gently as that leg extends and comes back? Then breath in. Relax those muscles. Exhale, connect, bring the leg back and in. That's the goal here. Now the deep core, the upper systems, that will be a separate video, which I will upload at a later date. But start with this and see how it goes. Okay? Of course, ask any questions below, any comments, or send me an email if you want the more in-depth video, either for your knowledge as a healthcare practitioner or your own knowledge as a healthcare consumer. It is education to help you understand your body better. I will be going over hemorrhoids and fissures, as well as vulvodynia, which is a pain in the pelvis, and how we can use this paradigm in a nuanced way to help restore balance to the pelvis. Like this video if you found it helpful, and I will see you next time.